Hi, everyone. I am Stephanie with Nine Health. This month, we are talking all about prevention during a pandemic. So, preventing some of the chronic issues, dealing with your risk, assessing your risk. We have new online assessments you can take for free at ninehealthfair.org. I'll post the link to the exact one for sleep apnea and to the homepage for that in the comments. So, look for that. But I'm joined by a couple experts today, Dr. Amy Wilson, and she is from Sleepwell, Southern Colorado. And she's a dentist, but also does treatments in the area of sleep disordered breathing issues like sleep apnea. And we started our online screenings in the lower Arkansas Valley in Southeast Colorado. So we're grateful to have an expert joining us from there. She's from Trinidad. We also have Nine Health expert Dr. Powell Coley joining us, who's a cardiologist, but also an expert in internal medicine, preventive medicine, so can answer all the other questions you have or even questions about sleep apnea, because she's been talking about that a lot this week as well. Thank you both for joining me. Let's get right into it. Dr. Wilson, can you first just break down what sleep apnea is, and then as a dentist, talk about how that relates to sleep apnea treatment?
Yeah, sure, Stephanie. Thank you for having me on today. Sleep apnea is the kind of thing that typically, you're in bed with somebody, your spouse, you're hearing snoring, and it's usually they're alerted and you think they stop breathing. Well, they actually do. It's an obstruction of the airway that causes the patient to stop breathing. When we're measuring that in tests, it's usually a minimum of 10 seconds. And you can imagine if you hold your breath for 10 seconds numerous times in the evening, you're probably not going to feel real good come the next morning. So it does cause daytime sleepiness, causes you to have some issues when you're at work the next day in your relationships. So it's a really important thing just socially. And then medically speaking, it's an underlying cause to a great many things that people are being treated for, as far as high blood pressure, high cholesterol, thyroid disease, diabetes, and higher risk for heart attack and stroke. And as far as how it relates to dentistry, there's some treatments that we do in dentistry for patients that have snoring and sleep apnea. And it's actually a custom fit appliance, kind of think kids retainer, that fits inside the mouth, and it's designed to open up the airway. It only actually really takes a few millimeters to make an impactful difference on how that patient sleeps in the night. They're recommended by the American Academy of Sleep, which is run by physicians, for patients that have mild and moderate sleep apnea, and even for those patients that are severe but are either unable or unwilling to wear a CPAP, and that's actually the mask that a lot of patients wear for sleep apnea.
Yeah, and I've just heard people talk about the mask before, and that's probably a reason maybe some people don't even investigate getting screened, because it doesn't sound
Yeah.
like a comfortable thing to have to sleep with a mask on and have to deal with all of that stuff. How does that help me sleep, kind of thing.
Right.
Dr. Coley, we talked about two different types of sleep apnea in our explainer video that we had run on the morning show this morning. Can you talk about those two different types and just the differences between those types of sleep apnea?
Yeah, so sleep apnea, more broadly speaking, just means lack of breathing during sleep, and there can be a number of different mechanisms. So there's two main types. One is called central sleep apnea, which means the center of the body, or the brain, so to speak, doesn't send the right signals to your breathing muscles to tell them to sleep, and that's the reason you stop, to tell them to breathe, excuse me, and that's the reason you stop breathing while you're sleeping. That's called central sleep apnea. The other kind that Dr. Wilson was talking about is called obstructive sleep apnea. That's much more common in adults, and I like to think of it like a straw. So your airway is like a straw. And if you pinch off a straw and try to drink through it, it's going to be nearly impossible. And you can't quite catch your breath. And that's really what happens when you're sleeping. Your straw or airway gets pinched off, whether that's due to the muscles in your neck relaxing, due to your tongue rolling backwards, or any other kind of airway obstruction. And that leads to the air not getting in, which then kind of startles you awake. So that's called obstructive sleep apnea. And then there's actually one that's called mixed, where you have the central and obstructive components and a little bit of both. Those are a little harder to treat. But when we talk about treatments for obstructive sleep apnea, those are generally more of the lower hanging fruit, because if you relieve the airway obstruction, whether it's with oral appliances, sleeping on your side, losing weight, doing many of the things that can make it a little easier for your straw to stay open while you're sleeping, then that actually is relatively easy to treat. And you mentioned CPAP, so I'll just mention what that means, because a lot of people wonder what that stands for. That's continuous positive airway pressure. So it's basically a mask, and it can be a full face mask that covers your nose and mouth, or they also have something called nasal CPAP that just goes into the nose. And it's basically like blowing air into your trachea or your straw to keep it open. So you're just continuously blowing a little bit of air or positive pressure into your airway to almost kind of stent it open so that it doesn't get too relaxed and close on itself. And I will say initially it takes a lot of getting used to from what my patients tell me. But for those people who truly suffer from sleep apnea and the consequences that we talked about of, you know, daytime sleepiness, fatigue, feeling awful all the time, problems with interpersonal relationships, increased risk for accidents, the CPAP actually changes their life. So I have patients who actually take it on vacation with them because they don't feel the same without it once they get used to it. So it does take a little getting used to, but if you're somebody with moderate to severe sleep apnea and you need CPAP, you really want to give it a good try because it can change the way you feel after a night's rest.
Yeah, again, we're talking about sleep apnea today, reducing your risk. We have a new online screening tool you can take right now at 9healthfair.org. It's free, just a questionnaire, takes a couple minutes to fill out. You get a score, then you know if you need to follow up with your doctor or a specialist. I put the link to that in the comments, so go ahead and click on that and do the screening if you'd like. Again, I'm joined by Dr. Amy Wilson. She's with Sleep Well Southern Colorado and a dentist that really works on treating these sleep disordered breathing issues. And Dr. Powell Coley, you can ask your questions in the comments. Many people are just saying, I put, how'd you sleep last night? So people are like, didn't sleep that great. Someone said they slept great because they're sleeping outside on their deck in the summers. That sounds nice. Let's just keep going though. Dr. Wilson, Dr. Coley talked about this a little bit. Just talk about further some of the issues that can be caused by untreated sleep apnea and how people can reduce their risk.
Sure. Yeah. Dr. Coley kind of alluded to that just a moment ago. There's a lot of just behavioral things and losing a little bit of weight, sleeping on your side, some easy things that can be done for those patients that, really have a big hill to climb. Once you have a home sleep test or a polysomnogram, which is a type of test that they do in a laboratory, these tests can identify whether or not you have sleep apnea. And then just seeking treatment. We are working collaboratively with cardiologists, with pulmonologists, with all types of folks in the medical field to just make sure that those patients are treated appropriately, whether that's with a CPAP again, or if you're mild to moderate, an oral appliance is a great way to go. Dr. Coley also mentioned, folks that travel, and, the CPAPs are a little bit easier to travel with these days, but some of my patients come in just wanting an appliance that they can have that is more easily, portable, that they can go and travel with. And so at least for the time that they're away, they've got something that's going to work for them.
Yeah, and I'd never really heard about that until I checked out, what you do and your Sleep Well Southern Colorado, the practice you have. Talk a little bit about what a dental appliance looks like. I've heard of CPAP. I'm not someone with sleep apnea, and I don't really know anyone close to me that has been diagnosed with it. But I've heard of CPAP. But what do the dental devices look like, or how does that work?
Yeah, again, just kind of think kids retainer almost, but these are custom fit. They only fit that person. And they're built in two pieces. There's a part that fits in the roof of the mouth. There's a part that fits in the lower teeth. And those pieces together, when the patient bites together, it takes the lower jaw down and forward. And the appliances that we made they're titratable. In other words, they're movable so that patient with me can kind of find that sweet spot, which is where they're able to have, reduction, if not elimination of any snoring and sleep apnea. Once we kind of find that sweet spot, that patient can then go back in lab or with a home sleep test to verify its efficacy, which I think is really an important part to make sure that you're being appropriately treated.
And we touched on this a little bit, but Dr. Coley, can you just reiterate some of the risk factors? How would someone know if they have sleep apnea? We talked a little bit about snoring at the beginning, but snoring is not necessarily something that is directly linked to it. It could be something that is a sign you might have it, but some of the other risk factors and how someone would know they have it.
So sleep apnea can actually occur at all spectrum of ages. There are even kids that can have sleep apnea. So if you have even a child or a baby that's snoring or appears to not be breathing while they're sleeping, it may be worth talking to their doctor. Another sign in children can be of what we call failure to thrive or not growing normally, because especially in kids, when you're not getting the right kind of sleep, it can affect your levels of growth hormones. It can actually affect a child's growth. So that's kind of kids and toddlers. When it comes to adults, usually snoring is the first tip off. So when I ask my patients if they snore at night, that's kind of my first screening question for sleep apnea. But as you pointed out, there are people who can have sleep apnea without snoring, particularly if it's the central sleep apnea type. So anyone who startles awake while they're sleeping, or if you notice that they look like they're startling awake, that's not so much that, that the snoring wakes them up, because sometimes people say, oh, you woke up with your own snoring. It's actually the brain sending a signal to the body to wake up because it's not getting enough oxygen. So that could be a sign that you have sleep apnea as well. And then, of course, as Dr. Wilson said, if you're tired during the day, wake up in the morning, you feel like you haven't slept, or as the day goes on, you feel extremely tired, you're dozing off during the day. Those are all potential signs that you may be somebody who needs to be screened for sleep apnea. And then if you're having other things, so sometimes as a cardiologist, the way that I end up finding sleep apnea is looking for things like resistant hypertension. So blood pressure that's very difficult to control. I keep adding more and more medications and nothing seems to be working. And the reason is because while you're sleeping and your brain's not getting all that oxygen, it's actually releasing all these chemicals that are raising your blood pressure because your body is under a stress response as it's not getting oxygen. So you get basically cortisol release all night long that can then affect your blood pressure during the day and make it very difficult to control. Similarly, things like atrial fibrillation, which is an arrhythmia or abnormal heart rhythm, can be caused by sleep apnea. So sometimes other things, medical things, point us to sleep apnea, also things like pulmonary hypertension or high blood pressure in the lungs, which can cause shortness of breath. That can be caused by sleep apnea. So what you usually want to do is ask yourself whether you're snoring, whether you're waking up or startling awake, or whether you're sleeping next to somebody who looks like they're not breathing, whether there's any daytime somnolence. And then if you have any of those medical conditions that are becoming more difficult to treat or are new onset, sometimes those can clue us into sleep apnea as well.
And we did get a question on Facebook a couple minutes ago, Dr. Wilson. I don't know if you can answer this or not, but someone asked about hormones playing a role in not sleeping properly. So I don't know if that's necessarily related to sleep apnea. But are hormones a factor? Like, would you maybe have sleep apnea at one moment in your life, say if you're pregnant, or hormones are changing and then it goes away?
I think, we do see a little bit of that, and to kind of kickstand onto that, something you and I had talked about a little earlier before the show is that, women do tend to be really underdiagnosed with this because I think typically providers are looking for the heavy set man. And so we're typically missing the women. And, we're missing the skinny fit lady that comes in because we're looking for this, rather heavy set guy. But the point behind that then is that, these underdiagnosed women, we're now finding the studies are showing that these ladies are also being treated for chronic fatigue syndrome and fibromyalgia, depression, anxiety, all of these things that are directly related to their sleep. So to your question, does that have something to do with hormones? Most likely. I'm not sure that I've seen some studies specifically related to that, but it would stand to reason, yes. And some of my postmenopausal women are, for a variety of reasons. I think, sometimes they're putting on a little bit more weight and that might cause them to have a little bit more obstructive sleep apnea. But, again, the point being, we really need to make sure that everybody's being screened. Otherwise we're missing people. And that's kind of where, my company comes in. We're working collaboratively with all sorts of providers in clinic to make sure that everybody is screened. We know that the doctors and their team are really, they're taxed already as far as the amount of things that they have to do. So we usually have somebody there in clinic that can just make sure that that screener is done, that interview is had, that face-to-face is done with the provider so that we're not missing anybody.
Yeah, and like, Dr. Coley's a cardiologist, and as she mentioned, someone might have high blood pressure, something else going on, and then that can be, she asked the question, well, how are you sleeping? So it really is a, collaborative effort between multiple doctors to get something like that treated. Dr. Coley, someone did ask, it's kind of, I don't know if this is kind of a strange question, but wearing a mask all day is making them exhausted and we can't gain the oxygen they need. Is there like a mask fatigue? This really has nothing to do with sleep apnea, but since we're in this COVID-19 pandemic world, maybe we can talk a little bit about masks and obviously not wearing your mask when you're sleeping, but.
Yeah, so there's a lot of myths circulating out there about masks. So the first is that they can cause carbon dioxide poisoning. So I want to reassure people that this is not the case. Now, of course, when you wear a mask, you're rebreathing some of that carbon dioxide that you've exhaled. So your carbon dioxide levels may slightly increase in your blood. So if I did a blood test on somebody who didn't wear a mask and then put a mask on them and checked a blood test several hours later, their level of carbon dioxide may just be slightly higher. But that is not carbon dioxide poisoning because our body is very used to maintaining what we call homeostasis, or a level where it can kind of adjust the chemicals and the levels of carbon dioxide and oxygen in our blood. So you may just be breathing a little bit faster because your carbon dioxide level is a little higher. One of the things I do know is when we wear masks, we generally tend to take shallower breaths, because part of it is you just don't feel the air sensation on your face. So people breathe just using the little bit of their lungs. So they're breathing very shallow instead of taking deep breaths. And when you do that, you can actually get fatigued over time, because you're really not kind of inhaling to your fullest capacity. So I do encourage people to take mask breaks during the day, because wearing a mask can be exhausting for psychological reasons, but can also impair your ability to take deep breaths, which I think can also affect your perception of how you're feeling and make you feel tired. You shouldn't wear a mask to sleep, like a surgical mask, because that's probably not a good idea, because when you're sleeping already, you're not breathing in quite the same way as when you're awake. And so if you're covering up your face with a surgical mask, that's not a good idea. The surgical masks, I want to clarify, are different from the masks that we use for sleep apnea, which are actually giving you air and oxygen. So the treatment for sleep apnea is a different type of mask, so don't get those two confounded.
Yeah, lots to talk about masks. We're definitely in a different world right now. And it's the reason that 9Health is really offering these online screening tools. I put it in the comments. You can go online right now and take a questionnaire to see if you're at risk for sleep apnea. And like Dr. Wilson said, it's not just the heavy set males that really need to look out for this. It's really all of us. And just talking about that, Dr. Coley, to follow up on what Dr. Wilson was talking about getting screened, who should get screened? Is it really just all of us should go take this screening just to see our risk? Is it only for having some sleep issues, waking up tired? Talk a little bit about who should get screened and just the online tools that we have right now.
Yeah, if you have a history of hypertension, pulmonary hypertension, daytime somnolence, weight gain that's unexplained, fatigue during the day, or as Dr. Wilson said, depression, you're just feeling run down, you have, just not feeling like yourself, it's a great idea to get screened regardless of your age. If you have none of those and are feeling pretty good for the most part and don't have any of those other risk factors that we talked about, then you probably don't need a screening at this time. But I would recommend some of the other screenings that we have on our website, like the cardiac risk screening and the diabetes screening, because it's never too early to start doing those, because with those, it's really important. The earlier you catch it, the more you can change the trajectory of the disease. Sleep apnea in general declares itself in some way, but those signs and symptoms can be very subtle sometimes. So it's really up to you to have your radar up all the time, to keep an eye out for fatigue, or keep an eye out for dozing off during the day, or even some people have trouble with concentration, those types of things. And of course, ask the loved ones around you to also look out and see if they've noticed anything different in your sleeping patterns. And if you're somebody who lives alone, you maybe want to, record yourself one day while you're sleeping. Just turn on your phone and put on the memo. And I have had patients do that, and they will be surprised to wake up in the morning and just hear how much they're snoring or how unrestful their sleep has been.
And Dr. Amy, someone asked, how would I get tested to see if I have it? So, our online screening is a good assessment for your risk, whether or not you have any of the risk factors, and then to follow up. But maybe you can talk a little bit about what getting tested really looks like for someone.
Yeah, you need to have a relationship with their nurse practitioner, their provider, their physician, their primary care. And, if they don't have that type of relationship, there are ways to set up telemedicine visits with doc via web, that kind of thing, so that at least you're getting a face-to-face with somebody who's going to do a detailed interview about what's going on with you. But past that point, a nurse practitioner or a physician can write what's called a prescription for a test. And that might be, if you have some other what we call comorbidities or other types of underlying medical conditions you're being treated for, you might need to be seen in what's called a polysomnogram or an in-lab test. Otherwise, it's very easy these days to also have a prescription written for a home sleep test. These days, they're pretty sophisticated. They really test for a lot of things, even though you're at home. For a lot of patients, is a lot easier. I feel like in a lot of instances, I'm getting more information from some of the home sleep tests just by virtue of the fact that you're able to be in your own bed and get a little bit more information. Polysomnograms are very important for some people that really need those, but they're either way, you're going to have to see a provider, either doc via web or your regular provider, to get the prescription for that. And then either a company like mine or your provider can lead you in the right direction to either have that home sleep test or that polysomnogram. So there's some great ways to get tested.
Yeah, and someone commented on our post on 9Health Fair too. I want to bring this up because I know we talked about some of the risk factors, and one of those, I think we mentioned, just having alcohol, substances, sleep aids before bed can also increase your risk of sleep apnea. This person says they're 67 years old, have a lot of sleepless nights. They take trazodone. Is that how I say it? For insomnia, most of the time only get 6 hours of sleep, don't like taking the medicine. So maybe you can talk, Dr. Coley, maybe you can answer this one just about how, those substances or those sleep aids can really maybe increase your risk for sleep apnea, but how would someone get off of that if they have insomnia?
So that is a tricky question, because on one hand, getting restful sleep and being able to sleep continuously, particularly for somebody who's plagued with insomnia, is important. But on the other hand, the sleep aids can interfere and cause actually both types of sleep apnea. So one is the central type that we talked about, where they disrupt the ability of the brain to really tell the muscles to breathe. And then the second is that they can actually cause, excess relaxation of the neck muscles and cause some obstruction. So I think the first and most important thing for somebody who does take trazodone and has sleep problems and thinks they may have sleep apnea is to really get assessed by a sleep provider in order to try to understand whether they would benefit from having some kind of a test. Because if the medication is causing sleep apnea, then a nocturnal oximetry, which is just checking your oxygen while you're sleeping, might be the easiest thing to do to see, is it really causing problems with your oxygenation at night? And if it's not, and it's making you sleep better, then it's probably okay to stay on it. But if it is causing problems with your oxygenation at night, then we do need to address this in a more holistic approach and try to see if we can work on things like sleep hygiene, alternative sleep medications, or if you need, an oral appliance or CPAP as an alternative to treat your sleep apnea. The last thing you want to do is take the sedatives to try to get good sleep and then create a problem that's going to actually make the quality of your sleep worse. So I think the starting point would be to try to see what type of sleep you're getting and get assessed by a sleep specialist and really see, is this something we need to address? Is it broken? And if it is, then take a step back and say, how can we really help you sleep better?
Yeah, and then Dr. Wilson, I don't know if you want to add to that at all. Someone did also just ask, and this is kind of, we'll start wrapping it up here. I've kept you ladies longer than I said I would, but someone asked, do oral appliances statistically help with sleep apnea and oxygen? I'm not exactly sure what that question means, but I think they're just asking if the oral appliances really do help. So maybe you can talk about a little bit about the work you do in those oral appliances.
Sure. Yeah. The oral appliances, we've been treating those for, for sleep apnea for literally, the last couple of decades, as long as the CPAPs really have been along, maybe shortly thereafter. But the point being that now we've had enough time go by that we've got a lot of comparative longitudinal studies that can compare the efficacy of the CPAP versus the oral appliance. Now, to Dr. Coley's point, the CPAP is the gold standard. For the number of patients that are either unable or unwilling to wear that, we now can look at these comparative studies longitudinally and see that these oral appliances are just as effective, which has been really great information for us to know. Another thing that they're really great for is oxygenation. For the longest time, that was a conversation I had with a lot of my providers, was I'm really concerned about whether or not this appliance is going to be efficacious when it comes to the patient's oxygen. And we now know that they're really great for that. Sometimes it's just a matter of opening up the mouth a little bit or moving that jaw forward a little bit just to improve that oxygenation. So they're great appliances. We can look at those comparative studies and be able to really prove that now.
Right. And I just got, someone sent us a message on Facebook. I'm just combing through some of the questions. We'll do one more question here and then I'll let you guys go. Dr. Coley, maybe you can answer this one. They said they have hypertension and a deviated septum, their left nostril, it's genetic. They find that sleeping patterns are also severely affected by alcohol. Any suggestions?
So that's kind of the perfect setup if you think about it, the perfect storm. The deviated septum can create obstruction to airflow through the nose. And then if you have, alcohol use, that can certainly, again, affect not just your central breathing patterns, but also how you're sleeping in terms of obstruction, help make you gain weight. And then finally, hypertension is one of those comorbidities. That's the chicken or the egg. Did the hypertension come first? Did the sleep apnea come first? Are they both kind of coexisting together? And you can't really get control of one until you really get control of the other. So for this person, I would recommend consultation with a sleep specialist. I would probably start with the home sleep test, as Dr. Wilson has talked about, where we can just put some monitors on you when you're sleeping at home to try to understand just what degree of sleep apnea you have. If it's, mild, then you could maybe just think about, some nasal septal surgery. But if it's moderate to severe, you're probably going to have to think about surgery and or CPAP together. So, but important to get it assessed, because you really do already starting to walk down that path where you're having hypertension and complications potentially that could be worse with sleep apnea. And then if you're somebody who uses alcohol and has an anatomical reason for sleep apnea, that's something that's not just going to get better on its own over time.
Yeah, alcohol initially might make you feel like you're going to sleep better, but yeah, it's going to cause some issues if you are prone to those issues. Thank you, ladies, both for joining me. We're going to sign off here and let you guys go. I do want to remind everyone that if you have a health question, whether it be sleep apnea, COVID-19, anything, you can call our 9 Health Neighbors line. It's 303-698-4455, extension 2005. Leave a message and a 9 Health medical volunteer will get back to you within 24 hours. You get to talk to a real person, ask your questions. We're not having our spring health fairs right now due to the pandemic. So this is one of the ways that we're trying to help out the community. Also with our online screening assessments. I posted the link to the sleep apnea one. I'll post a link to the homepage as well, where you can go and get your screening for your cardiac health risk, diabetes, nutrition. You can ask a medical professional question, and then the sleep apnea online screening. So some tools that we're offering you to try to help with your health, your preventive health right now during this pandemic, and help you be the healthiest that you can be, because it's important right now. So thank you both for joining me. And if there's any additional questions, you can post those in the comments and I'll get them answered by these ladies after our live. Thanks so much.
Good. Thanks, Stephanie.